uh, Dr. Helen, you have a boy, 12 years old boy, and his name is John. He is with his mother. He is known case of type 1 diabetes mellitus, and he has presented to you with the morning hyperglycemia, recurrent morning hyperglycemia. So just ask a detailed history, and if there is any concern, address the concern of the mother and the child.
How old is child?
Okay.
How old is child?
He's a 12-year-old. 12-year-old. Yes.
Okay. Child name is John and mother name is?
Mother name, you can say mom. Not John's mom.
Okay.
You have total 22 minutes, 9 minutes reminder, 30 minutes you will finish with the role player, and then you have to deal with the exam.
Okay, Dr. Rifat, I did not prepare. I will try. Huh? Don't grieve.
It's okay. I'm also not too much prepared for the questions.
Okay. All right. So
But I am ready.
we'll start. Okay. Hello, good morning.
Good morning.
I am Dr. Hiren, one of the doctor here. Today, I believe I am talking to mother of John, Miss Jessica.
Yes.
Okay. Mom, today I am here to discuss with you regarding condition of John. I have received a letter from the GP that there are some concern regarding John's high blood pressure, high blood sugar value in the morning.
Yes, doctor.
Yes. So, can you tell me a little bit in more detail why today you are here?
Yes, doctor. John was doing fine. He was taking insulin as doctor told us. But for the last 2 to 3 months, he's having his blood sugar is not controlled. Whenever we checked, it comes fasting sugar is raised, and we are trying to manage it with different things. But it is not manageable. He's still having hyperglycemia, high blood glucose level. So this is the reason why we were concerned and came to.
So, what do you think probably could be the reason why he's having this since past 2 to 3 months?
Yes, doctor. He's having so much problems. The study is getting more tougher with the time, and he's not eating well. But I still trying to give him proper meals, and he is taking medications, but the problem is still not sorting out.
So, where the sugar readings were normal 2 to 3 months ago?
Yes, it was doing fine.
Okay. And any other concern which you want to discuss, which is bothering you at this moment?
No, he's just having, he's not fresh, and he's having more problem in the study. Plus the pressure is more on from the school side, so he is trying to cope up with all these conditions, but he need more help in managing his blood sugar.
Okay. I'm sorry to hear about the kind of stress which John is going through. So can you tell me how much insulin John is taking currently?
He is taking 20 units, so 10 units of lentils,
Mm-hmm.
and 20 units, that is 3 times in a day.
So, okay, 10 of lentils and the remaining
That is
short acting.
Lispro. Short acting, yes.
Okay, all right. And Apart from this, is there any other problem like is he having currently any fever?
A few days back, he had fever,
Mhm.
and it was 103, and it remained for 3 to 5 days. He was also having the runny nose and mild cough. Then it was settled with some flu medications.
Okay. Okay. So at present he doesn't have any fever or
No, right now
uh,
he doesn't have.
okay. Okay. And currently he's only on this medicine, Lentus and short-acting insulin, no other medicine apart from this. Am I-
No, yes, doctor.
Okay. So, which doctor that of the team are you currently in follow-up for John's condition?
He was following the diabetic doctor, the hormone doctor, and
Okay.
a diabetic nurse,
Okay.
and uh, the other is not really much support. The pediatrician is there.
Okay. I see. Okay. And was John is maintaining currently any diary for the sugar? If you can tell me in detail, like since past 2 to 3 months, he's having this issue. So, which sugar reading is particularly high or low? If you can tell me in little bit detail.
Yes,
Uh,
in the morning, most of the time he is not feeling well, and whenever we used to check it, it come up high. And in the night, when we checked, it's normal. Uh, it's not too much. It's normal. It comes in the normal range. And if we check in the afternoon, that was also normal. So the problem is in the morning.
okay. And in the night time, you are giving how much insulin?
We give the bolus insulin, that is the long acting lantus, and according to the meal, we used to adjust the short acting insulin.
Okay, I see. And John is taking regularly as per the instruction of the gland doctor.
Yes, he is taking.
Okay. Um, any problem happen in the school at in last 2 to 3 months?
Yes, once he has the feeling of headache and he was having tremors. So at that time, blood sugar was checked and it was hypo. So the school nurse she gave him the some drinks to have, and then the blood glucose got normal.
Okay. And the school nurse is aware about his condition and he's getting regular insulin at school also.
Yes.
Is he okay in study?
Yes, he is coping with the study. But as the grades are going on, so that's why he's struggling in the study.
Okay, I see. And any recent change in the house, any recent change in the school?
No, doctor, he just came into the new grade. Otherwise, there is the condition at home are same.
Okay, I see. Okay. All right. Any recent change in the weight?
Yes, he lost 2 kg weight in these 3 months.
All right. And when he was diagnosed with this condition, diabetes,
He was diagnosed at age of 9 years.
and how he was diagnosed?
He was having tummy pain and he was not in his usual condition. And he was having vomiting. loose motion, fever. So we just went to the doctor. He gave us some medication, and he, for being on the safe side, he just checked the blood sugar, and it was really high. So at that time, he just referred us to the hospital where he required that he needed the admission, and they said that he had the complication of diabetes. So at that time, he remained in the hospital for 2 weeks, 2 to 3 weeks, and then gradually it got settled.
So he was hospitalized for 2 to 3 weeks.
Yes.
9 minutes.
Okay.
9 minutes.
After that, any hospitalization happened for the same condition?
No,
Or
after that, it's no, after that, no hospital.
okay. And is this John has any siblings, any brother or sister?
Yes, two brothers.
Okay, they are okay. Both of them are fine.
Yes, they are fine.
And how John is coping with this situation?
He is trying to do his best, but still having problem in with this high blood glucose level. That's why he is having the uh, compromise his quality of life. Uh, so this is the only problem. Otherwise, he was doing fine
And,
previously.
and is he following the diet advice from dietitian?
Yes, but it's long time to review the dietitian. We
Okay,
were planning to go to visit her again.
I see. Okay, all right. And uh, does he have any other other issues like any difficulty in vision,
No, no, it's okay.
any headache,
Yes, he often complained the headache.
okay, and any problem with pee?
Yes, he used to pee a lot in the morning,
Mhm. And any
and
any
sometimes also he used to wet the bed. Although he is 12 year, but still sometimes it happens.
any difficulty in poo?
No, that's okay.
Okay. And uh, any tummy pain, any problem with the digestion?
No, it's okay.
Okay, all right. Any problem with the hearing,
No, that's fine.
any joint pain, any skin rash?
No.
Okay, any financial issue? Do you have any support system?
Yes, we are registered with the this disability allowance system, and we are getting support.
And John's dad and both of you are working?
Yes, we both are working.
Okay. And how you are coping with this situation?
Yes, sometimes it is difficult to manage all these things. And but at that time, John used to take care. He's a big boy now, and he used to take care of himself. And he's very cooperative.
That's good. And he received his all jabs, all vaccination shots he received.
Yes.
Okay. And apart from this, any uh, allergy to any medicine?
No, no, doctor.
Okay. All right. And uh, any investigation done recently which you would like to tell me?
Yes, hemoglobin A1C was done, and it was 8.6.
Okay. Any other investigation, any other test results?
Blood sugar in the morning was high.
13
It
minutes.
was 11,
13
and
minutes.
we checked the blood,
Okay.
the ketones, and they are also positive.
13
Okay.
minutes.
Okay. Okay. Fine.
Okay. So can you please summarize the case?
Yeah. So today I took a history of a John who is a 12-year-old and who was diagnosed at the age of 9 years with the condition type 1 diabetes. Since past 2 to 3 months, John is having a low sugar reading in the morning, and John is receiving 10 unit of lentus and another 20 unit of short insulin before breakfast, lunch, and dinner. And his sugar uh, and his general health was good 3 months ago, but since 2 to 3 months only, he's having this issue. As per the mother, because of the change in the grades and due to a lot of uh, the exams and the stress, probably he might have this change in the sugar level or the low sugar readings. And on the background, he was hospitalized for the DKA, diabetic ketoacidosis, when he was diagnosed. And at presently,
Okay.
is with consultation with the endocrinologist and pediatrician.
So, what do you think? What is the biggest concern for the mother?
Yeah, the biggest concern for the mother, like since past 2 to 3 months, it is difficult for the mother, even though John is cooperating well, John is coping well, but the biggest concern is like he has to go to school and he is facing this issue, low sugar in the morning, and even the incident happened in the school also.
Okay. So, you mean to say that this is the uncontrolled blood sugar, sometimes hyperglycemia and sometimes hypoglycemia.
Yes.
So, what do you think? What is the cause?
Yeah, his HbA1c is 8.1, so it is showing like there is a poorly controlled diabetes. There are a couple of causes. The one is either it can be a condition called Somogi phenomena, in which condition the nighttime insulin dose is high, and because of that there is a hypoglycemia, and due to that there is a counter regulatory stress hormone release which cause the hyperglycemia. Another possibility, it could be like down phenomena, in which there is a growth hormone type of hormone release, and it causes the hyperglycemia post hypoglycemia. So this could be another possible differential. And the third thing
How
is,
would you differentiate between the two?
yeah, we need to check the sugar reading of the night, especially 2 o'clock and before the breakfast. So in condition with like Somogi phenomena, it will be hypoglycemia. In the night reading, there will be low sugar because of
So,
the.
have you asked about the nighttime sugar monitoring or the symptoms of hypoglycemia in the night?
I asked about diary and about the sugar reading, but in particular night I did not ask.
So, what do you think? What are the nighttime symptoms of hypoglycemia?
Nighttime he can have a tremor, he can have kind of fainting or uneasiness or discomfort.
Okay.
Because in the sleep, I don't know what other features can be
Okay,
there.
fine. And in the labs, how would you, apart from the blood glucose level, any other lab would suggest differentiation between two?
Yes, to differentiate between down and this, like hypoglycemia is the one. Second thing,
Mm-hmm.
second thing is uh, like HbA1c and all
Like,
well control in Somogi phenomena, because usually in Somogi, well, it's a well control and this happens. The
mm-hmm.
downline may be possibly HbA1c can be high. I'm not quite sure about this.
Okay.
Most
Okay,
likely,
so what do you think, this child has Somogai or Dawn or any other reason?
yeah, I would consider three possibility. It can be Somogi, less likely, more likely down, and the second thing is can be because of the stress and all which is going on in the school. Grade is changing, is a little bit struggling due to the change in the grade. So that is also
Mm-hmm.
that two possibility, and the third one is Somogi because HbA1c is also not good.
Mm-hmm. Okay. So how would you manage this case?
Plus there is a weight loss also. So
Mm-hmm.
uh, I would like to review strictly the night sugar reading, as well
Mm-hmm.
as I would like to take a help of the child psychologist also to analyze what kind of stress he is experiencing in the school, as well as the
Mm-hmm.
strict. He has a long back follow up with the dietitian. So again, I would like to book appointment with the dietitian. So again, we can bring sugar in the control with the
Mm-hmm.
help of diet, and
Mm-hmm.
with the general change in the lifestyle to minimize his stress and to bring him back into the normal life and
Okay.
control sugar.
Mm-hmm. And what about the insulin?
Yes. Uh, After reviewing, if it is like if it turn out to be a somogi, then I would like to reduce the dose of nighttime insulin.
Which
Otherwise, I will
insulin?
increase. Otherwise,
Rapid or basal bolus?
bolus.
Okay, good.
And
And
and if it is a down, I would like to increase the insulin dose.
okay, okay. So, any other plan in the management? Any
Yes.
long-term plan?
Yes. Also need to review, do screening for the celiac disease. Need to do screening for
Good.
the thyroid as well as the eye screening and urine dipstick uh,
Mm-hmm.
to monitor urinary microalbuminuria and nephropathy, as well as
Okay.
uh, he has lost some weight. So for that also, I would like to seek help of the dietitian.
Mm-hmm.
And
Okay. So, did you ask about how to manage the hypos?
seek
To know
advice.
how to?
Uh, you no, actually, I did not ask much detail about that, but you told me that this happened at the school, and the school nurse they give
They
some,
give drink.
yeah, and he was okay. So I would like to
Mm-hmm.
like advise him for the sick day rules, how to
Hmm.
manage
Good.
the hypos.
Okay. And did you ask about the medical bracelet that he is used to wear it or not?
No,
Okay.
Time over.
Yeah. Okay, fine. So, Dr. Hiran, it was really good because it was surprise for you and you really did very well. You covered most of the top parts. There are the certain things which need to be added. Like when I was saying that there is a issue of morning hyperglycemia in the problem list or the differential diagnosis, your list was good that you were thinking about somogai phenomena, dawn phenomena, and the other stressors. These were the things. So in this, the other apart from the stressors, there was another factor, that is puberty, because
hmm.
this boy was 12-year-old. Then the another factor, because of the school stressors, he is having less activity, physical activity time, so he was not able to do exercises. and he was not following the meals because both parents were working. And although John was trying to cope it, but it was not supervised properly. So he was not having meals properly.
Mm-hmm.
And Dawn phenomena is explained that like he's growing and he has the growth hormone excess. That's why it may cause this issue apart from the stresses. Then the somogai phenomena could also be there because he has lost weight 2 kg and he's taking insulin almost same and he's missing the meals. So considering these factors, the insulin dose is increased as per his requirement. So that is causing the hyperglycemia and then rebound hyperglycemia. So on the basis of history, we can say that this is the combination of dawn, somogai, stressors, lack of physical activity, and the proper meals
Mm-hmm.
uh, in the diagnosis type. On the basis of labs, in the differentiation of dawn or somogai, one factor that is helpful in differentiating is ketone urea. Like if the patient have hypoglycemia as somogai type, then they have the ketone urea. And if it is a dawn-like phenomena, then they will have the glycosuria, not the ketone urea.
So
Um,
in down will
uh,
be glucosuria and
Glycosuria, yes, glycosuria would be in both conditions. Early morning glycosuria would be in both the conditions, but in somogai ketone urea would be plus.
mm-hmm.
And then the sign and symptoms of hypos we can evaluate, like is he having nightmares, night terrors? Like the mother give the clue that he is 12 year, but still he sometimes used to wet the bed. So the dampness of the bedding is also one of the clue. Then headache. The child is not fresh in the morning. He used to complain of headache, and we can ask about the quality of the sleep. In the hypos, they don't have the good quality. So these are the indirect clues we can ask about the nighttime hypo symptoms the child had or not.
Okay.
In the about the other the fourth reason for this hyperglycemia could be the that the insulin is not absorbed, or the insulin technique is not good, or the insulin is expired, or the insulin uh, the things which are related, or the dose is not appropriate. So in that case, we should ask about that who is supervising to check the compliance, and whether he is rotating the injection site or not, and the storage of insulin when the it was last used.
Yes.
These are the things regarding
These things will
then
not all the time, not there or this will cause in the whole day, not morning.
not
Only
particularly in the morning, but also in the school as well. So the blood sugar is going erratic. There are causes as well. We have to ask so somogai, but we should also then we can say by surety that this
Mhm.
in the systemic symptoms, apart from the this gland doctor, this the thyroid issue. And Sick day rule. I want to ask about it in detail. That what is sick day rule? Can you share about it?
Rule like he has to maintain first of all sugar diary. Second thing, in case of the situation where there is a, you will advise like if there is a stressful situation, um, any illness, that's it, that during that situation he may need more insulin because hyperglycemia will be increased. Then you will also advise something about ketone or like DKA, like that. And you will also advise about the
Ketones are blood. I'm asking.
ketone in the urine, and also uh, you will advise to do the urine dipstick also.
Okay.
My
Sick
voice,
day rule
my voice clear?
that we have.
Quite unstable. Am I
It
audible?
was interrupted.
Okay. One more question.
So that we and the parents sick, then believe more, then they give extra how they collect can add in it. And meant that if the patient toast or crack drinks,